Welcome. It is Friday, 12 p.m. Eastern Time here in Charleston, South Carolina. Welcome to Ask Dr. Geier Live, the one time, the one place that I answer your orthopedic questions, whether it's injury, surgery, rehab, recovery, whatever. I will stay on for 5 minutes or 30 minutes, depending on how many questions we have, and answer all your questions. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, anti-aging and regenerative medicine expert, and media medical expert. I hope you feel and perform your best regardless of age, injury, or medical conditions. Georgia, good to see you. Very excited to have you here today. Jamie's got a question. I will get to hers in just a second. As always, please remember that I am not giving you medical advice in this live stream. Anywhere I do really anything online or social media, it is not meant for medical advice. It's meant for general information and educational purposes only. I haven't seen you, examined you, looked at x-rays, looked at MRI. There's no doctor-patient relationship established. So this is meant for giving you more information about that injury, about that problem, that then you can choose to talk to your doctor, your orthopedic surgeon, and say, hey, what about this? Maybe it's just translating, and your orthopedic surgeons generally can't speak plain English. That's what I have learned in 17 years of doing this. And when I was at an academic medical center, the first 8 years of my career, most of my partners there were really bad at speaking plain English. Some of my friends that would see some of my partners would have absolutely no idea what anything that doctor said about their injury. So I can be a translator for you as much as anything, but it is not specific medical advice. If you would like to see me, I'll talk about that at the end of the show, but there are ways to get in touch with me and schedule an appointment. I'll talk about that at the end. Also, I only do Ask Dr. Geier Live on Facebook. Georgia, Jamie, Elena from Austin, Texas. Very well, where'd it go? I don't know where Elena's comment went, but very cool there. Well, all right, Elena, it's not wanting me to show your comment, but Elena from Austin, Texas. My brother used to live in Austin, Texas, actually. But I'd love for you to leave your name and where you're located. Helps me know where everybody is. Few of you, I know that because you've been on this show multiple times before. Leave it in the chat, not in the comments. Every week I see after the fact people that said, how do I get my question answered? They're leaving it in the comments. You got to do it in the chat. That's the only thing I can see. All right, let me start back up at the top. I don't know what is going on with why this is not. There we go. Hey, what can I do for inflammation? My shoulders are killing me and the medication isn't helping. Okay, lots of ideas here. First of all, before I say what I would do, let me say what I wouldn't personally do. And it depends. Inflammation, is it a muscle? Is it a tendon? Is it inside a joint? Here is my thing. I am not a fan of cortisone. I did a whole Better Than Ever Live about 3-4 weeks ago on why I feel cortisone is really bad, especially for arthritis. But it breaks down cartilage and bone in a knee and a shoulder faster, speeding up arthritis changes. It's been shown to weaken tendons, weaken ligaments, making them less likely to heal and more likely to rupture. Yeah, you feel a little bit better short term, but that short term benefit is outweighed by much greater long term risks, in my opinion. Yes, I know almost every orthopedic surgeon out there does tons of them a month. I get it. There's so many studies that show that cortisone's harmful, that I just don't feel like it's a good treatment. Now, they would argue it takes multiple cortisone shots to get that effect. It's like eating donuts. Maybe one isn't so bad for you, but if you eat it every day, that's not so good. But even that one does potentially bad things to you. That's a bad example, but cortisone, not really good. I'm also not super excited about ibuprofen or naproxen. And this gets beyond some of the stomach issues, heartburn, ulcers, can cause lots of issues that way. People with high blood pressure and kidney issues shouldn't take those type of medications. But from a healing standpoint and an inflammation standpoint, they do stop the pro-inflammatory cytokines temporarily, the interleukin-1 beta, interleukin-6 tumor necrosis factor alpha. But there is some evidence that they may actually stop the anti-inflammatory cytokines too, the interleukin-4, the interleukin-10, the interleukin-13. So doing it once in a blue moon, probably not such a big deal. Not something that I recommend on a regular basis. The one that I am most intrigued by, even though it's a hard sell for people, I've talked about it in the arthritis world. It's also probably going to have an indication when it's FDA approved, likely 2024, for degenerative disc disease as well, but is the penisin polysulfate. That seems to be extremely anti-inflammatory, stopping the interleukin-1 beta, the interleukin-6 tumor necrosis factor alpha that cause so much of the problem. The problem with that is that it is an injected medicine. You have to get it from a physician, number one. It's not over the counter. And number two, it's a subcutaneous injection twice a week as opposed to a pill that you take once a month. Other things, ice, some people say can help with inflammation. There's some pros and cons to ice. Generally, I don't have a huge issue with ice. But there aren't really many other effective anti-inflammatories. The other big issue is whatever the problem is, you got to stop whatever is causing the inflammation. All right, Patrick. Dang it. There we go. Would a partial meniscectomy help prevent further tears? Would a partial meniscectomy help me return to skiing or return to skiing more quickly? It depends. And I actually did, not this past one but that I did yesterday, but the Better Than Ever Live I did the week before was on partial meniscectomy. Now, I don't know anything about Patrick, age, coexisting arthritis changes in the knee, things like that. Here's the thing, and I don't know if this is you. If you're 20, partial meniscectomy may not be as damaging, but here's the issue. When you trim out part of that C-shaped shock-absorbing cartilage, you have less shock absorber. The rates of knee arthritis down the road are much, much, much higher in that knee than, say, the other knee, or somebody that's never had a meniscus tear. Plus, in people with even early arthritis changes in their knee, that surgery is largely thought to be counterproductive. I know a lot of orthopedic surgeons, and I did this for years, they'll say, well, that's pain from the meniscus tear, surgery will help, but it won't help with the arthritis. That's been sort of debunked over the last 3 to 6, 7 years with studies showing that it speeds up arthritis. That surgery speeds up the need for knee replacement in people that already have arthritis. That's why there's European countries that don't allow that surgery in people 55, maybe 50 years old and older. The knee arthroscopy and partial medial meniscectomy, partial lateral meniscectomy. Having said that, and I've done hundreds and hundreds in 20s and 30-year-olds back before I stopped operating, that you just, 25, 30-year-old has just one little flap of meniscus, no arthritis changes. You go in and just trim that one piece of cartilage out, and it does well. I've seen that. So it depends a little bit on the dynamics. Oh, I really appreciate that. Dang it. I don't know what's going on with my eCam today, Georgia. I'm trying to put her positive comment up. I'll read it toward the end of the show. Jamie, we do not have snow here in Charleston. I only have seen snow one time here. It was I was actually on call. It kind of sucked. I had to stay at the hospital for 2 straight nights because we had 6 inches of snow, and they basically made anybody on call stay in the hospital even when you're sort of not working much because they didn't want you to not be able to come in. But no, it is in the upper 40s or low 50s right now. It was down in the 30s last night, but it rarely gets cold enough to need snow. Let me try that again. There we are. Georgia, you're always helpful with the information you give us. I really appreciate that. I do. All right, Elena from Austin, Texas. Is it a fair assumption overuse injuries tend to heal by themselves? Traumatic injuries more often need surgical intervention or not at all? Yeah, that's generally true. Overuse injuries can end up needing surgery. Stress fractures of, say, the 5th metatarsal on the outside of the foot, and in certain other areas, femoral neck stress fractures, anterior tibial shaft fractures, navicular stress fractures, those fairly often need surgery actually. But most of them, in fact, more than half of stress fractures in non-risky situations, low-risk situations, those heal. Overuse issues of tendons, ligaments, things like that, almost always heal without surgery. Now, whether a traumatic injury needs surgery really depends on what it is. There's a lot of traumatic injuries. An MCL injury of the knee would be a good example that can heal without surgery. Muscle tears typically heal without surgery. So there are a fair number, and then partial injuries of a lot of things can heal without surgery. But sure, there's a number of traumatic injuries. ACLs are probably the best example, that there isn't going to be much you can do about that. You're going to have to fix it surgically. And I still get, even though I've really transitioned to a practice where I try to get people to heal without surgery, there's some things I tell them up front, I don't know necessarily how well this will go. So, that's where I've gotten in for the people like that. Hey, you should get surgery. Here's who I'd recommend. But I can help you in the recovery process, get your muscle strength back faster, get back to running in sports faster with some of the ways I can speed that process up. But yes, generally, Elena, that was a good way to break that down. All right, Mary. I really don't. I'm just going to read it. I'm sorry I can't put your question on the screen, Mary. What can we do to combat cortisone shots' bad effects? Any vitamins? There's probably not much that helps other than not getting the cortisone shots. If you're saying, hey, I've already had some, what can I do about it? Yeah, there's a number of different supplements and vitamins that can protect to a certain extent musculoskeletal structures, muscle, tendon, ligament, bone, cartilage, things like epigallocatechins that are in green tea, but that really needs to be a supplement because there just aren't that many in a cup of green tea. Green tea is great. It's just not that much. Things like curcumin, things like magnesium, especially for the bone. Vitamin D, really good for bone and cartilage. What else? Omega-3 fatty acids, I would say, might be fairly helpful. But having said that, it's not really the same pathway. Cortisone, it may be subtle at first, and let's be fair. I really crush cortisone because I feel for most people it's really a bad idea. But if you're a little old lady with bone-on-bone arthritis, it probably doesn't matter that much putting more into the knee. But where I really have issues with people are these people that have rotator cuff tendonitis or bursitis in their shoulder that get cortisone after cortisone after cortisone after cortisone. I promise you do that enough, that rotator cuff is going to tear, not because of any traumatic event, but because that cortisone weakened one of those or multiple rotator cuff tendons a little bit more, bang. Just don't think it's a good idea. And there's plenty of studies to show that. That's what's really frustrating. There's sort of an economic reason I think that they're done so much in orthopedic surgery, but that's beyond the scope of this. So as far as ice and inflammation, it kind of helps, not really, and I wake up. Here's my thing. I wasn't really going to get into why I'm sort of pro or con on ice. I do feel like ice, after an acute flare-up, can decrease some pain and can decrease swelling. Now, there is some evidence, and the physical therapists are starting to really preach this, or at least a lot of them, say after an ankle sprain. One of the first things you do, that whole rest, ice, compression, elevation, and the thought is the ice gets the swelling down, but a lot of times you actually want blood flow to an area to get it to heal. Now, an ankle sprain is not inflammation per se. There's actually a ligament tear, but that's where they say ice can be counterproductive in the injuries where you want blood flow into a specific area. I feel like ice is fine. I use it periodically on sore parts of my body after workouts and things like that, but I don't know that it is changing the underlying issue that much. So that's kind of how I would look at it. Now, the flip side of that with inflammation is heat is definitely going to increase that. I know we love heat. Everybody loves heat, but it just feels great. But it probably is going to increase the inflammation by increasing the blood flow into that area. Okay. Georgia, yeah, I don't know what this thing's doing. I apologize. All right, I'll read Georgia's. My rheumatologist gives vitamin D and calcium as protection against cortisone. That would essentially make sense, at least as it pertains to the effects of cortisone in a joint, into the knee, into the shoulder. Probably wouldn't have as much benefit for cortisone shots for tennis elbow, cortisone shots for shoulder bursitis, for things like that, into tendons. But for bone and joint, and honestly, vitamin D and calcium, super helpful for so many reasons unrelated to cortisone. So I am, that's kind of my thought about that. Patrick, 62 years old. No prior pain. Yeah, this is the partial meniscectomy. Would PRP help meniscal injuries heal? And then he says, and thumbs up for the Lou Holtz book behind you. So I love Lou Holtz. I've met him several times. I've gotten to speak at a conference that he was also speaking at. He tells stories. He went on and on about all his different orthopedic injuries. He really liked me because I was an orthopedic surgeon. Super guy. If you ever have the chance to see Lou Holtz speak in person, cancel whatever you're doing, pay whatever it costs, and go do it. He is phenomenal. One of my favorite speakers ever. He's funny. He tells good stories. And his books have really great stories too, but you got to hear the voice. I don't know if on Audible or the audio book, if he reads them, but if he does, that would be a good way to do it. Really, really funny guy. Love Lou Holtz. Really wish he was still on TV. Too. Just a great guy. Anyway, Patrick, the PRP, it's interesting. The studies have been sort of lukewarm on PRP for meniscus tears, and it's not that I don't think it's helpful, because I use PRP in joints. I think exosomes are a reasonable option. I did a whole show yesterday on BPC 157 into knees. So there's a number of potential options. The studies haven't been super great on PRP for meniscus tears, even though people are starting to add them to meniscus repair surgeries, where they go in and put stitches in the meniscus to sew it together and hold it together while it heals, the PRP to stimulate the healing. One of the reasons meniscal tears have such a low healing rate is that they have no blood supply or very little blood supply, and so the thought is the PRP helps with that. Part of the reason I suspect that the PRP studies for meniscus tears where you just injected it into the knee aren't terribly great. One, coexisting arthritis, which may influence the results, and two, the joint fluid may wash away a little bit of the PRP, so that may be part of it. If it was me personally getting it with a meniscus tear, and if I was older and had some arthritis changes, well, I probably have arthritis changes at my age, so who knows. I would absolutely consider PRP before I had surgery. Not necessarily true for a 20-year-old, but that's personally what I would do. Not medical advice, just kind of my thoughts. Okay, that is all I see right now. If you would like to come see me as a patient, I would love that. Somebody that was on this show within the last month for Ask Dr. Geier Live is coming in the next couple weeks. I welcome you to do that too. In the description below this video is a link to my website, drdavidgeier.com. Go to the contact page, fill that out. My assistant and I will help you set that up. I can talk to you about all kinds of treatments, not just cortisone, physical therapy, and surgery, which is unfortunately what you get from 90% of orthopedic surgeons at this point. You are so welcome, Georgia. I will have a great weekend, even though I got to paint this weekend. So I've got some fun things planned, but I'm going to be painting later today and the next 2 days, which that's not so much fun, but that's all right. And not painting like for art, like painting rooms in my house. But okay, it is what it is. Very, very grateful that you're here. I hope you all have a fantastic weekend. I will be out Thursday and Friday next week for Thanksgiving holiday, at least here in the United States. For those of you out of the United States, Thursday is our Thanksgiving and Friday is Black Friday, where everybody goes crazy shopping. I don't do that necessarily, but I do watch the football games on Friday, so that's what we will be doing. And yes, Lou Holtz is amazing. If you ever have a chance to see him speak, I cannot say enough about Lou Holtz. One of my favorite, I've read a lot of athlete biographies and coach biographies. My favorites, Lou Holtz for sure. Bob Bowman, Michael Phelps' coach, amazing advice. He's just incredible. The actual Valerie Condas Field, the former gymnastics coach at UCLA that won 7 national titles, even though she was never a gymnast herself, fantastic advice, great biography. So those are some of the ones. There's probably others, but the ones that come to my mind right now. Georgia buys plane tickets on Black Friday. That's funny. I actually have never thought of doing that. I've got 2 trips I got to take in January. I may do that myself. That is great advice. Everybody have a fantastic weekend. Very, very much appreciate that you're here, and I will see you again real soon. Take care.